અરે આવજો તમે ચાલુ કરો ને યાર બીજું કાર્યવાહી હોય ને સાહેબ.
હા હાજી
તું ત્યાં જ રહી.
good afternoon. This is virtual CMU College of GP IMA Gujarat State Branch regarding health checkup and healthy lifestyle need of the hours. I welcome our Gujarat State President Dr. Bharat Kakadia sir, Secretary Dr. Mehul Shah, CGPA Director Dr. Jaswant Darbar, Dr. Mahadevbhai Desai Sahib, Dr. our speaker Dr. Digan Sastri, Dr. Urmanbhai Dhruv, and all other who joined this webinar, and Dr. Kasundra Sahib. So I request our President Dr. Bharat Kakadia to give his few words regarding this CM.
Good afternoon, everybody.
Very good afternoon, sir.
I welcome in this Zoom meeting, webinar meeting of College of General Practitioners. And as you all know, the topic is very day-to-day, and it is very related with the present time. The health checkup and prevention and our lifestyle. So our today's speaker, I welcoming him, Dr. Shashank Dr. Digant Sastri and Dr. Umen Dhruv. One is a pediatrician and looking after the pediatric healthcare, and the other our speaker will take about the adult health checkup and their lifestyle problem. So I wishing very much success to this program, and I am very much hopeful that we will do some concrete work about this subject. And as you all know that our state branch is working very hard about the prevention of the young cardiac death. So this is a subject which relate with the young cardiac death, which is very much prevalent subject at present time. So wishing all the success, and now I am requesting to start the function further. Thank you.
Over to Kasundra Sahib, given an introduction of our speakers.
Okay. Very good afternoon, friends. After in continuation of our educational seminar, Gujarat College of General Practitioner, IMA Gujarat. Today one is specific subject. Sir, I have declared the health checkup and health lifestyle. Yes, this one is really, we hear a lot of things. In Rajkot, in last Sunday, we have discussed regarding health, heart attack and its prevention, how to we prevent. Today one is, we have two speakers regarding this subject. One sir is a pediatrician. He will speak perspective of pediatrician, how to checkup and the health lifestyle for pediatrician. Today, our speaker, well-known pediatrician, Dr. Digant D. Sastri. He is MD, FI, AP, PGD, HHM, senior pediatrician, Kilol Hospital, Surat, NICU and Vaccination Center. Even is president and Indian Academy of Pediatrician, member standing committee, International Pediatric Association 2019-21, and chairman of AMR Task Force, International Pediatric Association 2019-21. He is the chairman of IAP ID Fellowship Government Counseling 2013 and 19. He has presented many publications. He has presented 40 publications, including 3 articles in Index Journal and 8 chapters in textbook of pediatrics. Now I request to our speaker, Dr. Digant sir, please take over the mic. Over to Dr. Digant Sastri sir.
Yeah, thank you, Kasundra sir. Am I audible?
Yes.
Yes.
Okay. Can the host enable me to share my slides? The technical team. Okay. Okay. I think once the introduction slide is discontinued, then I will be able to share my presentation. Okay. Yeah. So the slides are visible, right?
Yes.
Okay. So good afternoon, friends. At the outset, I extend my sincere thanks to IMA Gujarat State Branch leadership, Dr. Kakadia sir, Dr. Mehul Bhai, and of course, it's a pleasure to be the part of the sixth CME of College of General Practitioners, IMA Gujarat State Branch. And I remember when Dr. Mehul Bhai called me, and later on Dr. Darbar called me about this webinar, and we discussed about the subject. It's really very, very impressive that our IMA leadership is very sensitive about the deaths of youngs in our state. And recently, the last week, I think Rajkot, it was a huge success, a program for the public awareness. And in that context, this webinar topic theme is decided the health checkup and healthy lifestyle. But to be honest, in pediatric age group, there are not many deaths, or maybe not even a few deaths, sudden deaths, except in the infants, as well as there are no set guided health checkup plans in children. Of course, there are some guidelines regarding health checkup plans for the adolescents. So, in the next 20 minutes period, what I will be dealing with about the healthy lifestyle about in the children, and then in the last part, a few slides about the health checkup plans which are suggested by Indian Academy of Pediatrics for the adolescent age group. So, with this introductory note, let me start with the subject. And if you see the data of 2022, the different WHO regions and the population, the average children population worldwide is 25%. The youngest population is Africa, where 40% of the population is children. The Asia is more or less parallel to the world average, that is 24% population is children. And we know about the childhood starts from the birth to 18 years or 19 years. As per the government of India Gazette, it is up to 18 years. And in this age group, from birth to 18 years, the period is divided into the childhood, that is toddler, preschool, and primary school. And then there is an adolescent period. But the adolescent period is something different than the routine childhood. They are no longer child, and they as well as they are not yet adult. So their needs are different, and this is a time where there is a maximum rapid physical and psychological growth as well as development. There's a time where new capacities are developed, and there's a time of changing the social relationships, expectations, roles, and responsibilities. So this adolescent period is a very unique period, and we need to handle this period very carefully. If we talk about the statistics of India, the Indian population, about 53 million adolescents are there in our country. And as this is a transit phase of life from childhood to the adulthood, it requires nutritional support, education, counseling, and guidance, which will ensure the proper development into a healthy adult. This age group children, they are susceptible to several preventable and treatable health problems. These are the treatable and preventable problems like early or unintended pregnancy, unsafe sex leading to sexually transmitted diseases, nutritional disorders like malnutrition, anemia, obesity, overweight, substance abuse again very, very common, mental health problems, suicide, depression, injury, violence. These are the problems which happens in the adolescence age group. If you see the global statistics of 2022, the statistics about mortality and morbidity here depicts, this slide depicts the male as well as female different causes. The more for the mortality in the male, the injuries, road traffic injuries is leading cause, while in female, diarrheal diseases and tuberculosis tops the list. If you see the morbidity again, the behavioral disorders, iron deficiency anemia, anxiety disorders, and depressive disorders, they are in the top five causes for the morbidity. So, knowing this, the question comes, why should we invest in the health and wellness of the adolescent? The answer to this is that 1 in 5 individual, that is 20% of the world population, is adolescent, and the current decade, it is the largest number of adolescent in the history of mankind. And these children, they have a high mortality, about 2.6 million deaths due in this 10 to 24 years age group because of communicable diseases, because of injuries, as well as non-communicable diseases. And unfortunately, 97% of the deaths occurs in low and middle income countries. The other important cause why we should focus on the adolescent health issues is that nearly two-thirds of the premature deaths and one-third of the total disease burden in adult are associated with conditions or behavior that begins in the youth. Like a person who starts smoking at a younger age is likely to continue smoking till a longer period. So the bad habits or wrong habits which initiates in the adolescent age group could be the cause for premature deaths or could be cause for morbidity in the adulthood. The other important reason is that this demographic transition, it closes. See, if you see in this, the countries like Japan, Italy, there the adolescent transition has happened almost 30 years back. A country like India, 2025, 2030, there is a transition will happen, and then you will not have an opportunity. So if you don't focus on the adolescent in the current time, probably you may not be able to help our country in future. And for that reason, we need to act at this time. I won't go in the definition of the health. We all know that it is not just absence of disease or infirmity, but it is a complete physical, mental, and social well-being. And when we talk about health, health and wellness goes hands in hand, and health and wellness is combined, is a combination of physical fitness and good nutritional habits. So there are four pillars for the health and wellness, that is a physical fitness, nutrition, sleep, and stress. The first three are equally applicable to the children as well as to the adolescents. Of course, the current generation of students are also facing the stress, but we'll be discussing the first three factors in detail. So first is about the physical fitness, that is exercise. So we all know the benefits of exercise, that it secretes the endorphin and it keeps our mood happy. Also, it promotes healthy growth and development of strong bones, development of strong muscles. It prevents conditions like obesity and overweight, which can lead to morbidity, reduce the anxiety and stress, and also it reduces the risk factors for diabetes mellitus, and hypertension. So these are the benefits. We all know it, but unfortunately, the children don't know. So what are the recommendations for exercise for the children? Before we move on to that, there are four different types of uh, physical exercise, which is aerobic activities, muscular strengthening activity, flexibility activity, and your coordination activity. Now, the recommendations for children, it is said that every child should have at least 60 minutes exercise a day. If it is more, it is better. It should be a mix of both aerobic as well as muscle and bone strengthening activities, and it should be moderate to vigorous intensity physical activity. Now, where these children can have this physical activity? So, naturally, this physical activity can be done at any safe area, maybe at the school, maybe at a home, maybe at a nearby playground, or maybe at some sports club where children can get indulged in sports like swimming or sports like tennis, badminton, and this 60 minutes activity will keep the child healthy. Like our food pyramid, we have a exercise pyramid or a fitness pyramid where here the tasks are defined that every day there should be children should play outside. They should take the stairs instead of taking the elevator. They should help the parents or in household work or a work around in the garden. Similarly, 3 or 5 times a week, children can get indulged in various type of sports. The most important thing is a tip of this pyramid, that is curtailing the sedentary hours. That the children need to curtail TV watching, video or computer game, and sitting more than 30 minutes at a time. Because we all know that the sedentary life is the root cause of many diseases. The second pillar of the fitness is the nutrition, and we all know about that nutrition is important for each age group, but because the childhood is the foundation of human life, and if there is a poor nutrition, it will have an impact till the next generation of that individual. Like a child or infant who is poorly nourished will have a increased susceptibility to the infection, will have a poor scholastic performance. When this child grow as an adolescent, the child may be wasted or stunted or may be overweighted if it is overfeeding. There can be anxiety or depression because of the body image, and there is an increased risk of diseases like diabetes, hypertension, and other conditions. And when this adolescent grows to the adult, and if she is a girl, then her fetus is exposed to the undernutrition or overnutrition. This may lead to the intrauterine growth retardation, and it will lead to the poor pregnancy outcome. So this is a cycle, and so we need to act at the beginning of the uh, cycle, that is at the childhood. There are certain nutritional issues in the adolescent, that is obesity and overweight. Both undernutrition is equally common, and this is leading to anemia, micronutrient deficiency, increased consumption of junk food. Again, it's a problem of the century. And then there are eating disorders like anorexia nervosa, bulimia, or avoidant of or restricting food intake. So these are the adolescent nutrition issues. When we talk to our patients about the food, they need to be told that the child should have at least 5 meals a day: breakfast, early morning snack, lunch, evening snack, and dinner. And again, the distribution of the calories should be that the three major feed, that is a breakfast, lunch, and dinner, should be about 25% of the calorie, and the morning snack and evening snack can be 10 to 12%. The meal should be well balanced. It should have cereals, pulses, fruits, vegetables, dairy products, and of course, water. We should not forget about the water. When we talk to parents about the healthy food habits, we need to tell that the half of the plate should be filled with fruits and vegetables, and the rest of the half, that is a 50%, again 25% by the cereals and 25% by protein, that is in a form of uh, your dals, and along with that dairy products should be used and water should not be forgotten. Gujarat is a predominant vegetarian population, so we need to educate the parents about the different vegetarian source of protein like pulses, sprouts, soya beans, nuts, which can suffice the protein requirement of the children, because protein is very important for the growth of the children. At the same time, we need to advocate about choosing a right type of drinks. That is, drinks like chas, aam panna, lassi, lemon water, coconut, and of course, water itself is a best drink. Strongly discourage use of all aerated drinks or market products like fruities or thumbs up. Coca-Cola, all these things should be avoided. Similarly, about the snacks, we should promote the homemade foods and we should discourage the padikas or the packed foods. We will discuss why it should be discouraged. The mothers are many times confused what can be offered to the child for the breakfast in the lunch box. So IAP has come out with the menu for the uh, children with a different social cultural backgrounds, and here is some list of some items which mothers can give to the child, which are the healthy items which can be nutritious to the children and also taste wise also good. So one should not forget that child should not skip any meal, particularly the breakfast. And if by chance child is in hurry to going to the school and going to miss the breakfast, it should be catch with some fruit or homemade snacks or even a boiled egg, which will suffice the morning that 25% calorie. There should not be screen viewing while eating. Again, we have seen that many parents tell, સર મોબાઈલ બતાવીએ તો જ ખાય છે, અથવા તો મોબાઈલમાં જોતા જોતા જ ખાય છે, અથવા તો ટીવીની સામે બેસીને જ ખાય છે. So we as a doctor need to educate the parents. We need to educate the patients also, children also who are coming to us, that they should not indulge in viewing the screen while eating. And again, another one message we should pass is always eat the fruits rather than drink the juice of that fruit. So eating the cut fruits is better than taking the juice. We talk about junk food, but what is junk food? Earlier, I also was believing that junk food is a food like sandwich or a pizza or a burger. They are the junk food. But the definition is these junk foods are the food which are higher in fat, sugar, salt, preservatives, caffeine, coloring or flavoring agents, and they are low in protein and fiber and vitamins and minerals. So the junk is a acronym, and it is like junk is a food which is having high fat, sugar and salt, which is ultra processed food. It is nutritionally inappropriate food. It may be caffeinated, colored or carbonated drink and sugar sweetened drink. So yeah, even our some items which we eat in our home like jalebi or samosa, though even if it is made at home, they are high in content of sugar or high in content of salts, and they falls in the category of the junk. Similarly, cookies also fall in the category of the junk. The packed potato chips also fall in the category of the junk. So this junk should be discouraged, and the children should be advised to take the healthy homemade food for the breakfast or for their school tiffin. The third pillar of healthy life is the sleep, and there are studies which have shown that in the age group of 18 to 24, they suffer more impaired performance due to lack of sleep. Usually, this age group children they are having habit of remaining awake till 3 a.m. or 4 a.m. in the morning and then they sleep. So naturally, it hampers their performance on the next day. Again, the fatigue mind or fatigue body, it is involved with road accidents also. And the insufficient sleep will lead to hormone linked obesity. So these are the reasons why children should have a healthy sleep habits. So what are the healthy sleep habits? The child should have at least 7 hours daily sleep. They should avoid the afternoon naps, but by chance if somebody is habitual, then the afternoon nap should not be more than 30 to 40 minutes. There should be a standard bedtime, like between 8 to 10:30. So there should be a conditioning of the body. Children should avoid screen disturbing or seeing the shows at least 1 hour before going to the bed. So they should not see some horror movies or some action movies on the even TV also before 1 hour. And instead of that, one can encourage the children to read the book or play a light music, which will lead to a good sound sleep. Again, the cell phone, the villain of the current century, the children should keep, even I think the adult also should keep the phone at least 4 feet away from their bedside. But unfortunately, we also don't follow it. And avoid heavy dinner, avoid items like chocolates, caffeinated drinks so that it will not disturb the sleep. A word about screen time is definitely needed as a healthy habits, and we know that nowadays the very common scenario in the drawing room, all family members are seeing their own mobile or in laptop and nobody is talking with each other. So the American Academy of Pediatrics and IAP both has come out with the recommendations for the screen time, and particularly for children up to 18 months, no screen time. Toddler less than 1 hour, again in a supervision and for the educational purpose. For children 2 to 5 years, 0 to 3 hours, again mainly for the educational purpose. For kids and teens, again 2 hours per day is a maximum upper limit for the screen time. So this is about healthy habits for a healthy life. Now the health checkup. So as I said earlier, that there are no set protocols for health checkup in children, but for adolescents, the Indian Academy of Pediatrics has come out with adolescent-friendly health facility initiative, under which we have given the recommendations for the adolescent health checkup. So the adolescents should have a yearly consultation. This consultation should include clinical nutritionists because they are likely to prone to develop nutritional issues like undernutrition or overnutrition. In a case of girl, she should have a gynecologist consultation. For both boys and girls, a pediatrician consultation, and for dental caries, again dental consultation is recommended. In each this visit, there should be a recording of anthropometry, height, weight, and body mass index. Blood pressure should be tested, measured in every visit. And nowadays, in last 3 4 years, there is an alarming rise in the incidence of hypertension in adolescent age group. So it is recommended vision test and again dental test. And screening for hearing, screening for depression, screening for anemia, and screening if there is a history suggestive of tuberculosis, one should go for the screening for the tuberculosis also. At this same time, one should not miss the opportunity to check about the immunization. That is, firstly, to check about the completeness of the immunization schedule. If the child has not completed the schedule, then child should be recommended at least these three adolescent vaccines, the MMR vaccine, Tdap vaccine, and human papillomavirus vaccine. The other health checkup component is investigation. So in the investigation, to rule out anemia, complete blood counts, for obese children or children who has got history of family history of death in first degree relative, due to cardiovascular event, they should be offered oral GTT as well as lipid profile. And in sexually active adolescents, there should be annual screening for HIV and syphilis in form of first void urine for leukocytes in boys and swab for gram stain culture and KOH in girls. When we talk about these recommendations, I need to at least make our listeners, our viewers aware about this Rashtriya Bal Swasthya Karyakram, that RBSK, that is by Government of India. And this is again uh, program which is focused from children from birth to 18 years, where it covers 4Ds, that is defect at birth, deficiency, diseases, and developmental delay, including the disability. And under this RBSK, the every year the government is conducting screening at government and government aided schools, where children between 6 to 18 years of age group, they are screened for 4Ds, which I earlier mentioned. This is done at the school itself, done at least once in a year, and they use the two different tools. That is, one is questionnaire, which is in the local language, and another is a clinical examination. And for this questionnaire, conducting the survey, they have the ANMs and staff nurse. And for the clinical examination, the team of two Ayush doctors, one male and one female, is provided by the government. So this is about the protocol for health checkup in the government setup by the national government. So friends, these are about the healthy lifestyle in the recommendations for healthy lifestyle in the children, as well as health checkup plans for the different age groups. And we need to inform all this knowledge with our parents or with our patients, so that they remain fit and they remain healthy. Thank you so much for the opportunity, and I will be happy to take any of the questions.
Hello. Very thank you, sir, giving so much very informative information regarding the health checkup and healthy lifestyle in children. Great. Now we are passing to the second speaker. Even is the physician, Dr. Urmil Dhruv, sir. I know very well to her. Even is MD, and he is at present Director of Department of Internal Medicine at HCG Hospital, Ahmedabad. I know sir as a diabetologist, because we frequently meet in RSSDI. Now, without any waiting time, I give mic to Dr. Urmil, sir. Over to Urmil, sir.
Thank you very much. Thanks a lot. Can I share my screen now? Thank you. I hope I am visible and audible both.
Yes, sir.
Good evening, everyone. Thanks, IMA GSB and all the officials who are present here for allowing me to speak something about a topic which is very close to my heart, which I believe to be safe. But within next 20 minutes, we'll realize that feeling safe about the heart is something different, and having a healthy heart is something different. And that is probably the reason of today's discussion. So, greetings, everyone. So, we all know we are going to talk about physical fitness and preventive health checkups. It all started with this very devastating figures. Heart attack deaths increased by 12% in 2022 in India. And in Gujarat, in last 6 months, 30% of people dying of heart attacks were below the age of 30. And this created a panic. I'm sure most of you must be knowing this gentleman, a 28-year-old gentleman. He is actually a famous Russian Olympic skater, Sergei Grinko, who died of a heart attack in 1995 while practicing for a performance. How did we realize that he died of a heart attack? He only had a back pain symptoms, but and his DNA examination suggested that he had one of the rare genetic disorder which makes somebody susceptible to premature heart attacks. This was 1995, meaning thereby this is not a new scenario having heart attacks in younger age group. Yes, because of social media, because of print media, and because of more awareness, and because of few other reasons, yes, we can say that heart attack incidence is increasing in younger age group. The definition of physical fitness has already been dealt with. We all know in a good physical or mental condition, in good health, free from disease or pain. Now, this is one of the best article that I could find in last 6 months, and that was changing landscape of heart attacks in Odisha. Just as Gujarat is having high number of younger individuals suffering from heart attacks, similarly, there were a couple of studies in Orissa also, and that suggested that it was sedentary lifestyle, unhealthy dietary habits, stress, mental health, tobacco and alcohol use, lack of awareness, financial burden, psychological impact, limited access to specialized care. Probably that is one Gujarat fortunately does not have. Promoting healthy lifestyles and stress management and mental health support. But the most important of all was early screening and detection, and affordable healthcare services were not there. So let's first jump on to early screening and detection and thereby preventive health checkups before we move on to the tips to prevent heart attacks in the younger age group. What is preventive health check? What are the aims of preventive health check at any age? Now, number one aim is identifying any pre-existing diseases or likely risk of a particular disease before the onset of actual symptoms. So in a way, preventive health checkup is for primary prevention, if not primordial prevention, which means before the disease takes place, we need to search for it. Preventive health checkup is also aimed to specifically screen for a chronic disease or contain a series of tests to ascertain the overall health condition of an individual. And it helps to identify health risk, and therefore you can take certain corrective steps before any chronic condition settles in. We always polish our shoes regularly. We always send our car for service. Keep a calendar, 6th of December, the car is due for service. Multiple phone calls are there, reminders are there, notifications are there from the company also. But have you ever seen any physician or any hospital sending a notification to our patients that your regular annual checkup is due? Come and join us. Well, for us, probably car is more important than our health. Why do we need annual checkup? First and the most foremost, very, very important, probably the biggest myth, healthy people can also fall ill. Most of the time, we believe, I'm healthy, I cannot have heart attack. So remember, healthy people can also fall ill. It's an aging process. The aging does not start at 40, 50, or 60. Aging starts the moment fetus starts developing in the womb, and then when the newborn is delivered. That's the time when aging starts, as we all know that the fatty streak in the coronaries start depositing between the age of 1 and 10 years of our life. Reasons why you need the annual checkup: if you have a sedentary job, and who does not have, except for 30% of people all across India 70% of people are having a sedentary job. And third and most important, early detection could lead to cure. For example, let's talk about somebody who has been detected to have diabetes at the age of 50 for the first time. And when you look at his retina, there is diabetic retinopathy. And the retinologist says that that seems to be present for about last 3 years. He's shocked. But yes, if you would have been detected with diabetes earlier, this would have been possible. You can always ask, we are talking about young people. Why are you talking about somebody above the age of 50? Well, diabetes is no more a disease of 40s and 50s. We'll say diabetes is a disease of 20 and 30, and that too type 2 diabetes, which means very soon we'll have diabetic retinopathy at the age of 25 and 30, diabetic nephropathy at the age of 35, and end-stage renal disease at the age of 40, with people going for dialysis from one place to another at the age of 42. All these things can be prevented if there is early detection of chronic diseases. And the most important, probably the one that we hardly give significance to, and something that has been taught to me by my teacher, Dr. Gigi Oza Sahib, and my mentor and teacher, Dr. Madhav Bhai, giving significance to family history. Remember diabetic nephropathy, diabetes itself, hypertension, most of the chronic diseases have family history. And if you look at the family history, you can judge that this gentleman requires screening or health checkups at a much earlier age rather than waiting little late. If my father had heart attack at the age of 45, I should get up, I should wake up at the age of 25. So family history is very important, clinical history very important, habits and addiction very important, vital statistics very important, and general body examination. Now look, the title. The title says this is annual health checkup. Unfortunately, for us, annual health checkup means going to a laboratory and giving blood. No. Annual health checkup includes all these things and, if required, certain investigations. Health checkup does not always mean investigation. So important thing is you should go to a one doctor, stick to him, and allow him to understand your family history, your previous medical history, your clinical history, your habits and addiction. Be honest. Vital statistics, measuring blood pressure, respiratory rate, and heart rate. These are very, very important, especially at a younger age when we are having young hypertensives at the age of 25. Heart rate. There are so many people who are having a very high heart rate, suggesting a sympathomimetic type A personality at the age of 27. Now, if you have opened your eyes and kept an eye on the pulse rate of a person who is coming to you at the age of 25, and if you find his resting heart rate to be 110, well, be ready, is going to face the music from cardiologist within a couple of hours. So a resting heart rate at a young age is far, far more important than getting an ECG done at a young age. Even general appearance can also point to certain parameters, like type A personality. We all know flight, fight, and fright. Bhagi jau, dari jau, and ladi levu. These are three typical responses of our anxiety or our response to anxiety. And those who are having the personality of fight, they are more prone to develop heart attacks. And these are the things which a parent can pick up or a teacher can pick up during college or school time. And occasionally a boss can pick up within first 2 years of service. General body examination includes examination of teeth, gums, sinuses, nose, ears, and eyes. And remember, the the parameters or the markers of atherosclerosis are seen much at an early age, especially acanthosis nigricans, which is seen at the age of 25. Let's look at the test which require to be done during annual health checkup. People have done screening for prostate cancer and ovarian cancer at the age of 25. And it's really shameful when we go for the packages, which we'll see soon. But important things are hemoglobin, urine analysis, lipid panel, ECG, and blood chemistry. But apart from this, I would give more significance to heart rate and measuring blood pressure. Remember, blood pressure. We have got a lecture with me and Dr. Madhav Bhai that blood pressure or high blood pressure is one of the diseases easiest to diagnose, cheapest to treat, easiest to monitor. You don't require pricks. You don't require money to measure it. So, blood pressure measurement should be probably the most important of all topics. Does one size fit all? No. Even in animals, one size does not fit all. How can you say that one size fits all? And therefore, there cannot be standard packages which can be recommended, as my colleague has also told about pediatric age group. It depends upon your age, gender, and various other factors pertaining to your lifestyle. How often you do need these checkups? Generally annually, but depends again upon the results of this test. If they are not proper, then you require more frequently. Unfortunately, we have a tendency to trust packages that gives more taste. Packages like 76 tests in one health package. Now, if you look at this, most of them are, I would have to use the word stupid taste, which gives nothing like toxic element test. Urine for so and so and so. Metabolic profile giving you 137 parameters. Even if you are getting it at a reasonably low amount, these are not indicated. For example, unless you know your hemoglobin, there is no sense of going for iron deficiency profile. Again, the other package is arsenic, barium, cadmium, and that is really stupid. Diabetic profile, I do not know what are the reasons for giving this diabetic profile, where you give uric acid and calcium, which have no significance. So, let's come to the topic. What should be the minimum recommended investigation for a premarital person? Hepatitis B and C, HIV, VDRL, family history and genetic counseling, blood group RH typing, urine physical examination, routine blood counts, especially anemia. Remember, even anemia can precipitate heart failure and heart attack. And we never know that our HB is less than 9. So blood counts, especially hemoglobin and blood pressure and screening for diabetes and screening for lipids. This is more than enough. So remember, whenever you are advising somebody screening test, you should know the specificity and sensitivity of a test. Specificity means how many times out of 100 the test would be positive and disease would be there. Sensitivity is how many times out of 100. If the test is negative, you can rule out something. And screening test required to be sensitive. For example, X-ray chest at the age of 25 in the absence of respiratory system, respiratory symptoms or breathlessness on exertion may not be a specific or sensitive test and may not be helpful until advised by a properly working brain of a doctor. So this is very important. You now know vehicle insurance policy, most of us. And when it comes to renewal, we have started looking for the terms and conditions, which says that we'll provide this much facility and this much facility. Most of them are useless. And therefore, we select it judiciously. Same way, when it comes to selection of the health checkup plan, we should always choose it judiciously for younger generation. A plan which looks for diabetes in the form of HbA1c, because even if you're done fasting plasma glucose, you will require to go for HbA1c. So HbA1c would be a better option in a good reputed NGHS accredited laboratory. BMI, it's not an investigation. It is to be decided by the treating doctor or a medical personnel. BMI, very, very important. Family history of heart disease should be a part of the health checkup. Looking for dietary habit should also be a part of our health checkup, which we hardly do. Alcohol consumption, high blood pressure, history of smoking, history of, high cholesterol levels, illicit substance abuses. These are important things which require to be looked for during annual examination of a person between the age of 25 and 35. Remember, always ask about the use of non-sugar substitute, because WHO has recently come out with a guideline that in people who are not having diabetes, use of non-sugar substitute led to increased cardiovascular incidences. We cannot pinpoint at present that it is the sugar-free substitutes which are responsible for increase in cardiovascular events, but it may be. And therefore, asking about the use of sugar-free also makes an important thing. COVID. Is COVID an important cause? Yes, probably ICMR has come out with guidelines that those younger people who suffered with COVID pneumonia or a serious COVID disease, in those cases, the chances of increased cardiovascular mortality has been seen, and therefore, history of COVID has to be a part of annual examination. Anemia, I have already said. In fact, any viral illnesses, recurrent viral illnesses itself, just like COVID, can predispose you to a thrombogenicity in the blood and can cause the possibility of cardiovascular disease. And for that matter, any inflammation. In fact, recently a couple of papers have come out that recurrent gastroenteritis, it being an infection, can lead to ultimately MI. So let's see health screening for 15 to 35. Blood pressure, cholesterol, diabetes, very important. Dental and eye examination, very important. Physical examination and testicular examination, very important. If you are not examined the external genitalia, the younger generation may not tell you and ultimately may end up with depression instead of getting it corrected in cases of undescended testes. Occupational health risk, especially the teachers or the people who are standing for a prolonged time, and skin examination. Couple of investigations which are considered to be hi-fi are actually not screening tools, but they are very helpful. For example, ambulatory blood pressure monitoring. In a person of 25, if I find blood pressure records of 140/90 in my clinic, I would definitely send him for ambulatory blood pressure monitoring to either stem as hypertensive or stem as normotensive. Same way, continuous glucose monitoring system once in a while, not always, but in few selected cases, may help you realize that this young boy of 23 is having post-dinner high sugar, or Holter monitoring in a 22-year-old girl coming to me for palpitation, and I can find out atrial fibrillation followed by thyrotoxicosis. Apple Watch can also find out arrhythmias and once in a while treadmill test. But again, all these things would depend upon the family history. What about vitamin B12 levels, vitamin D, thyroid function test, homocysteine, or recurrent investigation? Well, they are not indicated. I got my own grudges for vitamin B12 levels, so I have for vitamin D, unless you have got reasons for the risk of having low vitamin B12 or vitamin D, you should not investigate. Remember, low vitamin D or low vitamin B12 has nothing to do with heart attacks. By recurrent investigation, I mean many times it happens that a 25-year-old boy comes to you with obesity. He has done fasting plasma glucose, PPBS, HbA1c, even serum C peptide levels, and still you go on doing it. Okay, let me try it again. This is already 3 months back. Well, those recurrent investigation, so falling on other side also is not going to be helpful. So coming back to the last part of my story, tips to prevent heart diseases or heart attacks amongst the young. Of course, the first and foremost is forget Sahir Saab. Sahir Saab said, मैं जिंदगी का साथ निभाता चला गया, मैं फिक्र को धुएं में उड़ाता चला गया. Those days are gone. Sahir Saab is gone, and with him, that mentality of throwing away the stress in the smoke. We should throw it up. Don't smoke, don't use tobacco. Avoid drugs. By drugs, you all know, you have seen, everybody has seen today's title. 25,000 kilo drugs have been recovered in 1 year in Gujarat only. Remember, this is the tip of the iceberg. So, no to drugs. But if you have been, even at the age of 25, suggested certain medicines for hypertension, for dyslipidemia, for controlling your tachycardia, etc., etc., then do not avoid medicines thinking that at 22 I should not take them. Get moving. Aim for at least 30 to 60 minutes of exercise daily. Eat a heart healthy diet. It's absolutely a different topic, but you should be careful about the fat containing diet. You should be very careful at the age of 20 and 30. Maintain a healthy weight, meaning thereby ask the person, younger age group, to look for behavior. Manage stress. Well, it's really very, very tough to manage stress in 2023 and probably in 2024. But still, you have to do it. And for managing the stress, you have to remember one important sentence. And that sentence is, stress does not come from outside. Stress is our response to the changes in the surrounding, which means a person like me, if he just travels from Mahalakshmi to HCG hospital, which takes 5 minutes, would be stressed like anything. And a couple of my friends who will be traveling from here to Mumbai within 6 hours, they would not have stress. So stress is our response to surroundings, and we should change our response. But the most important thing is get regular head screening test, and if abnormal, then you should take the proper steps. Few of the important things. My doctor said only 1 glass of alcohol per day. I can live with that. I do not know from where this idea has come that 60 ml of alcohol has been very health friendly. Well, it is 60 ml of not alcohol, it is 60 ml of the red wine. Nothing to do with alcohol directly. So please do not use these two important things for our younger generation. Smoking, obviously, no. Not only smoking, even the smoke kills. And therefore, while you are out in Delhi these days, you will have to wear mask. Pizza time. Important things that you need to send to our younger generation is keep a control on the portion size. We don't keep a control on portion size, and that leads to problem. And the one thing that very importantly my pediatrician colleague said, very important, never sit in front of TV, neither you nor your kids of 10 years or kids of 25 years should not sit in front of a television and eat. Whenever you want to eat, close down the television. Exercise is a must. This is what, if we don't see on a fitness center, we routinely see on the airport, right? We have commonly seen. And this is what we routinely see in the gyms now. So always remember, for our younger generation, this should be a slogan for next 2 years. Sitting is the new smoking. Our younger generation is doing work from home, 8 hours sitting continuously in front of the screen. They don't get up, they don't drink water, and most of the time, because they are working in a Western countries offices, they are working at night, so no sleep. So remember, at every 30 minutes, whenever you are sitting for a prolonged period, at every 30 minutes, get up, have a move, mobilize your limbs and go back to your work again. Last few slides, tips to prevent the heart attacks in young. Important thing is contact a good, responsible doctor and stick to him from the younger age. Do not ignore symptoms, however mild they are. Even neck pains, jaw pains have turned out to be the heart attacks. So do not ignore a symptom which is new. Contact your doctor, inform him. Everything that is non-allopathic may not be safe. And who else but Gujaratis know this in these days of these Ayurvedic syrups? I'm not against any pathy. I'm only against the notion that non-allopathic is always safe. Remember, children walk on the way created by parents, just as pediatricians walk on the way created by physicians. Just a joke. But therefore, if you do not follow a good, healthy lifestyle, obviously your kids are not going to do it. If you are eating pizzas and all junk food outside, how can you advise your children? If a teacher who is found eating pani puri outside, how is going to tell his students about the hygienic food? Remember, both the extremes are difficult or dangerous. Exercise and unaccustomed exercise, both are difficult. In the days of gyms, where the younger generation is very much inclined, chalo gym chalte hai, and my friend is doing so much exercise, let me do it. That is probably one of the reasons why we are finding lots of death these days while walking on a treadmill. So important thing, before starting an exercise program, get a green signal from your doctor. Even if you are very young, even if you do not have any symptoms, and especially if you had severe COVID, always contact your doctor before starting exercise. And the most important, please do not Google. Ask for authentic websites from your medical professionals. They would guide you. And please do not rely on this social media universe. So, heart attack, how to prevent: healthy diet, avoid alcohol, lose weight, check blood sugar, sleep well, stop smoking, exercise, check your blood pressure regularly, manage them well, have the eat well plate. Prevention is better than cure. Preventive health checkups are very important, but that should be as per your family history, as per your age, as per your BMI, and as per the suggestion of your doctors. Don't have blanket health checkups. Selection of health packages should depend upon these five important things. Remember, most of the chronic diseases have a theory of seed and soil, which means seeds are genetics which are there in almost all Asians. Soil we are providing. If we don't provide the soil, then the disease may not grow as a plant in our case. So remember this forever. Healthy people also need doctors. It's untrue that I am asymptomatic, so I do not need any medical aid. That is probably the biggest myth in 2023. So let's make heart health a priority from a young generation. Thank you very much.
Hello. Great, Sarji. You and Dr. Dhruv sir and Sastri sir both are master blaster for the health awareness program. Great, sir. You have advice? ગુજરાતમાં કહેવત છે કે પાણી આવ્યા પેલા પાર બાંધવી. આપના કહેવા પ્રમાણે વરસાદ થયા પેલા પાર બાંધવી. Now I request to Dr. Vasant sir for the any query, question or follow.
Sir, there are hello, I'm audible, right?
Yes.
Yes. There are big question mark in the people who are living in the Gujarat of they are questioning the what is the cause of sudden death. Just recently in last 6 months, there are many young people died in Gujarat, and we are explaining the cause of death is heart attack or cardiac arrest. Do you think they need postmortem and autopsy and all family history and other studies?
Absolutely, certainly, yes. The the autopsy, medical autopsy, not the post-mortem examination, would be of tremendous help in these cases, because few of these cases which we stamp as heart attacks may have normal coronaries and they might have died because of cardiomyopathy, which is a known cause of sudden cardiac arrest, especially it's one of the genetic causes of sudden cardiac arrest. And so are multiple other causes like bicuspid aortic valve, where which is once again a congenital disease where you get arrhythmias even at a younger age. So that's the reason why all those who die suddenly may not be dying of heart attacks, as we call in medical language, or coronary artery disease. Plus, as you rightly said, a family history of premature heart attack should also prompt us to think about it. So, sudden cardiac death does not always mean heart attacks. In fact, in younger generation, I would attribute it more to the arrhythmias rather than the coronary artery disease, unless probably the patient had a very bad COVID. That is one place where there would be hypercoagulability and there could be a reason for heart attack in the form of myocardial infarction. But otherwise, very rightly said, it could be cardiomyopathy, bicuspid aortic stenosis, and many other causes which could have led to arrhythmias and death.
Is there any chance that is a post-COVID pulmonary embolism? There are chances of pulmonary embolism to make a sudden death in youngsters?
Very less likely. Pulmonary embolism incidence during COVID also was reasonably low as compared to the control group. And many of the studies have now proved it that pulmonary embolism was low. In fact, immediately once the COVID was over, we started doing D-dimer in few of our patients having dengue. And then we realized that even in dengue, D-dimer goes very high. So D-dimer, upon which we had completely emphasized our theory of pulmonary embolism or giving anticoagulant, does not stand very true. That is number one. Plus, pulmonary embolism would generally not lead to sudden cardiac arrest. It would generally lead to breathlessness, chest pain, difficulty in breathing while walking, reduced walking distance, etc., etc. So the deaths that we have seen within last 1 year, especially last 6 months in Gujarat, does not fit into pulmonary embolism following COVID. But yes, hypercoagulability following COVID leading to probably MI.
So one question, should we focus on lipid profile, homocysteine, ApoA, ApoB in a pediatric age where there is a strong family history of fathers and grandfathers?
As I mentioned in the my presentation about the recommendations for yearly adolescent checkup recommendations, I am talking about the adolescent particularly. So there, if there is a family history of hyperlipidemia or a family history of sudden early cardiac death, in that case, definitely lipid profile should be done at a yearly basis in adolescent age group.
Yeah.
Blood pressure, as I told, see, nowadays we have seen that in many schools when we go for the health checkup camps, so, and even the RBSK, when they conduct the school health checkup, a high number of children, they come with hypertension, and probably one of the reason is the consumption of high salt formulas, like all your packaged foods, they are having a high content of sodium. To as a preservative, they use high content of salt. So, and children, they nowadays eat all kurkure or wafers or all type of packs. So that leads to high sodium, and along with that, sedentary lifestyle. એક પેલો જોક છે ને કે ભાઈ કઈ ગેમ રમે છે, તો કે હું ઇન્ડોર ગેમ રમું છું, તો કઈ મોબાઈલ ગેમ કે કોમ્પ્યુટર ગેમ, એનો ચેમ્પિયન છે. It is like that. Our current generation, see, partly we are also responsible for that.
Definitely.
The children, they don't have playgrounds, they don't have safety outside. So the school curriculum is so overburdened that the children are hardly getting any time to play, which we all enjoyed during our childhood days.
Definitely.
I request Dr. Madhavbhai Desai sir to give a take-home message from both these two speakers. what,
first of,
uh,
yeah, sure,
what
sir,
are the
sure.
priorities for the healthy life and healthy health checkups?
વસંતભાઈ પહેલા મને એક આજે મારા માટે વધારે ગર્વની એ વસ્તુ છે કે મહાદેવભાઈ સાહેબનો હું સ્ટુડન્ટ હતો બીજેમાં અને એમની હાજરીમાં મને પ્રેઝન્ટ કરવાની તક મળી. સો થેન્ક યુ
We
ટુ
all are lucky.
Thank you very much, everyone. I think both the speakers lead. Had we been in the auditorium, we would have given a standing ovation for sure.
Yes.
It's covered so well. There is no question
Definitely.
about it. That is from the bottom of my heart. But I think we have to emphasize on few things. One of them is that, as we said, we must tell our patients and the relatives that we should pay for our good health and not for ill health. માંદા પડે એને માટે પણ માંદા ન પડે એને માટે ડોક્ટર પાસે જવું જોઈએ. That is what we have stated, but that is what we should say loud and clear, including at the IMA level. Second, charity begins at home. So it starts with us and all the people who are celebrities, who are seen as a role model. આપણા IMA ના જે કોન્ફરન્સમાં જે આપણે ખાઈએ છીએ કે આપણે જ્યાં જઈએ છીએ ત્યાં જે લોકો જુએ છે. So I see many patients who tell me that સાહેબ તમે જ ખાતા ત્યારે હું એમ કહું કે ડોક્ટર કહે કરવાનું ડોક્ટર કરે નહીં કરવાનું. That's not correct. Honestly, that's not correct. We have
Yes.
to be as a role model. And today, what Dr. Urman said, I like that. We have to know the difference between drug and medicine. See, drug is different, medicine is different. Medicines are must, drugs are definitely big no. So that's what we must do. And the health checkup schemes also there, as he said, getting the arsenic and cadmium, and we don't know really they must be doing it or not. How do we expect a 1200 rupees and 87 days? That is something. And when they come to us, they spend at least waste our 10-15 minutes for nothing. Right. So something that we should have a very, very tailor-made health checkup schemes, and we should not encourage these things even if they are very inexpensive and they come at our home and collect the blood. I think that's not something we should ever encourage them. Even at the association levels or these clubs levels and all, they arrange for this. Instead, we should be probably arranging for subsidized rates of vaccinations. That is going to definitely have a more preventive role. And everything is said, as they said, that we must insist for the annual health checkup, like annual maintenance for our big cars that we always go for. So otherwise, they have done wonderful. And thank you very much to make me a part of this CGP webinar. I have been enjoying all these webinars all the time. Thank you.
Thank you.
Thank you, sir.
Thank you very much.
Thank you.